Hi there, this is Dr. Brett Bingham from Intermountain Pet Hospital again, and today we're going to talk about the question of the week, and that is, what could my dog be allergic to? Now, I'm going to separate this into two parts. One is potential food allergy and the other is environmental. So we've already talked about in previous videos that environmental allergies are much more common than food allergies. 85% of the time it's an environmental allergy. So we're going to talk about just the environmental allergy right now. So as far as environmental allergies go, they can be allergic to just about anything in the environment, including grasses, and there's tons of different variety of grasses, tons of different kinds of weeds, trees, mites, and molds and fungi. When I say mites, dust mites, I'm talking about dust mites in the environment, not mites that bite a pet, but the dust mites that live in the environment. But those are the five main things: grasses, weeds, trees, mites, and molds. Okay, so how do we know which one of those it is? Well, most of the time it doesn't matter, because most of these things are in the environment year-round, and dogs can have year-round allergies to any or all of them, particularly dust mites in the house, because that's year-round, and molds tend to be a year-round problem. But it really doesn't matter which one of those they are allergic to. There is a little blood test that we can do. It's a screening test. It's around $73 or so, and it will screen for environmental allergies. It basically puts the allergy in a category. Does your dog or cat have a grass allergy, or a mite or mold allergy, or weeds or trees? So it'll put in a category. Sometimes it's nice to know that. The blood test is not 100% accurate, but it gives you a really good idea of which direction to go. If you do the allergy test and it's negative and you're still very suspicious that there's an allergy, that's when we get more aggressive with a feeding trial to rule out a food allergy, and we're going to talk more about that later. But if you do the blood test and it's positive for environmental allergies, pretty good chance that your dog does have environmental allergies. Now, how do we treat it? Well, there are lots of different treatment options. Steroids work really well to stop allergies. They stop the itch, but they're not good long term. You know, they make them drink a lot, eat a lot, pee a lot, have a lot of side effects. They're hard on the organs, the liver, the kidneys, the pancreas, everything. High risk of diabetes. So it's good in the short term, but not in the long term. There's some really good options that are good for long term, and that's Apoquel. That's a medication that can be given daily or every other day or twice a day, depending on the severity. My favorite is Cytopoint, which is an injectable that lasts anywhere from 4 to 12 weeks. Average is probably 6 to 8 weeks. So I have a lot of patients that come in and a technician gives that injection every 6 weeks, and that controls their allergy. So it's super safe, has no side effects. It's not even a medication. It's called a monoclonal antibody. So it's an antibody that binds up the chemicals which relay the itch signal. So Cytopoint's a great option. Antihistamines might work in really mild cases, but usually not. Antihistamines cause more sedation than they do help with itching. They work great for mucous membrane allergies, but not for skin allergies. Atopica is a medication that can help with allergies, but it can cause some nausea, and it's pretty expensive, so it's not a great option in most cases. The last thing is immunotherapy, and that is allergy shots, just like people take for allergies. Yeah, mixed results on that. 1 out of 3 dogs does really good with that. 2 out of 3 dogs does okay, and the last third, it doesn't do any good at all. So immunotherapy, I'm not a big fan of immunotherapy. It doesn't work that great on most patients, and oftentimes they still need other medications to control the allergy, and it's kind of spendy and it's a pain in the rear. So it's an option. But in my opinion, now that we have so many other good options like Apoquel and Cytopoint, there's very little use for immunotherapy anymore. That's my opinion. So that is kind of an overview of environmental allergies. We're talking about that because that's the most common cause of why a dog is itchy. But I want to stress that even if your dog has horrible environmental allergies, 90% of the time it can be managed really well with any of those things that we just talked about. Sometimes even a medicated shampoo helps these dogs because it helps put a seal on the skin and protects them from the allergens which contact the skin. Those are all options that you can talk about with your veterinarian. But that is a very common question we get. Why is my dog itchy? And those are a lot of the options that we use to treat it. Thanks. Have a good week.